Hello everyone, my name is Dr. Satyajit Chauhan. I'm a fetal medicine specialist practicing in Guwahati in Pratiksha Rainbow Children's Hospital. Today I'm going to speak on a topic called the Peri Callosal Artery. Most of us, we know about the Peri Callosal Artery, but today I'm going to tell you certain facts which probably many of us, we don't know about it. So it is not only the Peri Callosal artery. I'm going to speak little bit on the anterior cerebral artery, the branches which usually we see while documenting the Peri Callosal artery. So when we see this picture on the neurosonogram, when we see this corpus callosum starting from rostrum, genu, body and the splenium, when we see all the four parts of the corpus callosum, usually there is no need to document the Peri Callosal artery. But in certain cases, when the mother is obese, the baby is in breech presentation, and we cannot do the neurosonogram. And if we are trying to see the CC, we could not able to see the CC because of various reasons. Then we can apply the color Doppler or power Doppler to document the Peri Callosal artery. Also, in cases where the mother had an history of callosal abnormality in the last pregnancy, and in this pregnancy, after coming to you at NT scan, and she is asking whether doctor you can tell me about whether the corpus callosum will be normal or not. We all know that corpus callosum starts forming from 16 weeks and completed by around 20 weeks, but we can look at the Peri Callosal artery in the first trimester, and we can give a little bit of assurance about the normality of the corpus callosum in the second trimester. So this article published in 2022, which shows that if we can visualize the Peri Callosal artery at the time of NT scan, it is highly specific for presence of normal CC later in pregnancy. So you see this video. Usually when we see this kind of branches, we assume that this is the Peri Callosal artery, but this is not the Peri Callosal artery. This is the anterior cerebral artery, and this part is the callosal marginal artery. This is callosal marginal artery, and this one which is coming, the thin one which is coming here, is the Peri Callosal artery. In this picture you will see better that this is callosal marginal artery and this is the Peri Callosal artery, okay, along its course. So until and unless we know about the anatomy of the Peri Callosal artery, how the course of the Peri Callosal artery and the different branches, it is difficult to predict or comment on the Peri Callosal artery in difficult situations. When you see the Peri Callosal artery in the second trimester, you see there are so many vessels are coming up. This is the Peri Callosal artery, we all know about it, but we really don't know about these branches, so many branches which is coming up. Today in this video I am going to talk on these branches, what are the name of these branches and what are the variations which can exist in such cases. This still image, you can see this is Peri Callosal artery and lot of branches. So Peri Callosal artery, it arises from the anterior cerebral artery. There is a lot of classifications of the anterior cerebral arteries there in the neurosurgery perspective, but for a fetal medicine specialist we just need to keep three branches in the mind. One, it is the pre-communicating artery, post-communicating branch, and third is the distal to origin of the callosal marginal artery. I'm going to explain it little better. You see, this is pre-communicating. Pre-communicating means this is circle of Willis, right? And this is the anterior communicating branch. So this part is the pre-communicating A1 segment. These two, from this part beyond the communications, this is A2 till the branches of Peri Callosal artery and the callosal marginal artery branches. This segment is called A2 segment. and this segment, Peri Callosal Artery entirely, is called the A3 segments. Okay, to give you more insight about, we can see this, that this is uh, the A2 segments, and from there this is the inferior, this is the orbitofrontal artery which is arises, this is frontopolar artery arises, and at the level of the genu, this A2 segment of the anterior cerebral artery, it divides into two branches. One is the Peri Callosal artery running across the upper border of corpus callosum here like this, and this is, which the most common branch we see is the callosal marginal artery, and it runs along the upper border of the callosal sulcus. Again it has three branches. One is the anterior, middle and the posterior inferior frontal arteries. So this A1 segment has this anterior communicating and this lenticulostriative branch. A2 has recurrent artery of Hubner, orbitofrontal and the frontopolar artery. I'll show you all these branches in the subsequent slides. And A3 segments is the most important one, where we see the callosal marginal artery which I talked about and the pericallosal artery. So I have put forward different images to give you more clarifications about it. Okay, so you see this is internal carotid artery. Okay, this is the A1 segment and this is A2 segment. This is A2 segment. From this A2 segment, the first branch which arises is the orbitofrontal artery. The second branch which arises is the frontopolar artery. And at the level of the genu arises two branches. One is the pericallosal artery, we know all about it. Second is your callosal marginal artery. And the moment it arises, it gives three branches. This is anterior, middle and the posterior. Anterior, middle and the posterior inferior frontal arteries. Okay, these are the, and it runs across the upper border of the callosal sulcus. I'll show you that video again in the subsequent slides. You need to see this. You see, from the pericallosal artery there arises some other branches. One is the paracentral artery. Here it is the paracentral artery, this part, and this is superior and inferior parietal artery. The same, the important branch, you see this is callosal sulcus. You can see this groove is the callosal sulcus and this is corpus callosum. From this corpus callosum, in this picture you can see that this branch which is coming, it's called the, running along the groove, it is called the precuneal artery. I'll show you here. In this picture you can also see that this paracentral artery arises from the callosal marginal artery. If you see the previous slide, this paracentral artery is arising from the pericallosal artery. None of them are wrong. These are the normal anatomic variations which is seen, and all these things, it is good if we can keep that. So now coming to the actual scenario, this is what we get. This is the circle of Willis, you can make out very clearly, right? This is the pre-communicating or the A1 segment. This is the post-communicating artery. This is the first branch. This is the frontopolar artery which is arising, and this is orbitofrontal artery. This is the orbitofrontal artery and this is frontopolar artery. These are branches from the A2 segments. And this part which is arising here, this is the callosal marginal artery. In the callosal marginal artery, I have mentioned this is anterior, middle and the posterior segments of the frontal arteries are there. Here you can see this is the paracentral branch, and this is, which one is going like this, is the precuneal branch of the pericallosal artery. Many times it is, you can see that you are seeing the pericallosal artery up till this segment. This is the This is paracentral segments. In this picture, this is the callosal marginal artery, paracentral and precuneal branch. This part is not seen, and many times I have seen people commenting that precallosal artery is not corresponding with the corpus callosum, but this is not true. This is based on the angulations. If you see this video, based on the angulations, you can see the corpus callosum very clearly. This is the orbitofrontal artery, frontopolar artery running across. This is the callosal marginal artery. You can see all these segments, anterior, middle and the posterior. This is paracentral branch, precuneal branch. This is one. If you see this video again, callosal marginal artery, this is arising, pericallosal artery, frontopolar artery. This is the precuneal artery which is going on this direction, paracentral artery. This is circle of Willis, right? We know the fact that this callosal marginal artery, it runs along the upper border of the cingulate sulcus. Okay, so this is a video. This is a transabdominal picture at 30 weeks where you can see the cingulate sulcus very clearly, and also you can see that this callosal marginal artery is running along the border of the cingulate sulcus. So this callosal sulcus is not evident in the anomaly scan. It is evident only after 24 weeks, and there you can see that it is running along the upper border of the cingulate sulcus. Okay, a lot of variations of the branches of the callosal marginal artery are there. It is good that we should know few of the common variations, and if you know the anatomy very clear, we'll definitely have a better idea about what exactly we are seeing, what we should see in the first trimester, in the second trimester. Okay, so thank you so much for watching this video, and please subscribe and share for more update. My channel name is Fetal Academy Half. You can find it out on the YouTube. Thank you so much. Thank you again.